anything for money. God, come save this country from this scam called William Ruto. Now, your health data, not your health data. Data ya Wakenya wote is at risk. Imeuziwa US. Now listen. Kenya becomes the first African country, hizo nchi zingine zimekataa. But Kenya becomes the first African country to sign controversial US health MOUs, earning $1.6 billion in funds dispersed through the next 5 years in exchange for healthcare data and specimens for the next 25 years. Anything for money, as long as it's business. He doesn't care. Hajali kabisa. Now, mimi sijui who is leading this country? Which kind of a person do we have as a president? Nataka nikusomee, nikuonyeshe pole pole ile maneno ambayo inaenda kufanyika. What it means by William Ruto signing that MOU, the health data MOU, the healthcare, it is unconstitutional. Health data MOU. Now, sign, the US will get the full access to Kenya's entire national health database. Every HIV test, ukipimwa TB na huko, ukipimwa malaria, kila kitu accessible to US officials. It will be accessible to US officials. Now, your medical data records, hiyo ya watoto wako wenye unapeleka clinic, hizo vitu zote. Na ujue data ni private Kenya. Na ujue our rules and our laws to protect the data in Kenya are stronger than the US. Tuendelee. Data yako hiyo ya watoto na kila kitu. Hakuna ati anonymous, hakuna kuweka anonymous. Sina consent yako, si wewe umekubali. Hakuna restrictions, wanaweza ona kila kitu. Now, these are the laws that it violates according to the Kenya Constitution. Number 1, the Kenya Data Protection Act, completely ignored. Number 2, Health Act confidentiality provisions, bypassed. Digital Health Act, it was not considered. Now, this is the most dangerous clause ya hiyo agreement according to Nelson Amenya. Nelson Amenya ni ule mtu ambaye alitoa ile nini ya Adani. Mwenye alitoa ile exposure ya Adani. This agreement shall be construed in accordance with the US federal law. What does that mean? Let me read it again for you. This agreement shall be construed in accordance with, not Kenyan, not whatever, US federal law. Now, that means the US law, not the Kenyan law, will govern your health data. What does that mean? The Office of Data Protection, the commissioner is powerless. Kenya courts are powerless. Your data protection rights do not exist. Are you getting what I'm saying? In the name of money. In the name of money, kumbuka ni zile pesa ambazo tunapatiwa whatever, na hizo pesa tunapatiwa zinakuja kulutiwa kwa nchi. Ni zile pesa tunaambiwa tujenge barabara na pesa zetu tuchukue tunajenga atitol barabara na mnalipa fuel levy. Ni zile pesa wanakopa wanakuja wanaweka na huko Dubai, wanashare na huko hata ifiki Kenya. That is what is happening. Now, it gets worse. Do you know why? Kenya must hand over disease specimens within 5 days of US request after the signing. US will share with 10 private American pharmaceutical companies so that they can develop vaccines and drugs from our diseases. Kenya gets nothing guaranteed in return. US serves its own needs first. 25 years of this agreement. Now, do you know what? The healthcare in this country, in Kenya, inakuwa devolved. Inakuwa the function of the county government. The county government was not involved. It was not consulted. Mulichagua rais ambaye hakusupport the 2010 constitution. Alipinga. He does not abide to the rule of law. Now, what will happen if we don't, the government does not remit the data and whatever? We will be blackmailed financially. Failure to fulfill commitments could result in changes in planned assistance or discontinuation of this MOU. Translation: give us your data or lose your money. What the US government will access, not just statistics, not just aggregated data. They will get direct system access to any patient record. Haki ya Mungu. Rights to audit 5% of the healthcare facilities randomly selected in our country. From colonialism to digital colonialism. Let's continue. Access to lab results, treatment records, epidemiological data, metadata and system architecture, real-time disease surveillance, and all diagnostic and testing data. Now, what does this mean? 50 million Kenyans medical privacy gone. Just because of what? Money, which will not benefit us as Kenyans. Do you know what? That agreement was not drafted. It is not legally compliant. It poses critical constitutional sovereignty risk. Hakuna mahali watu walikaa kwa boardroom, the professions, the whatever to discuss about the impacts. Ama the dangers, the risks of doing such a thing. That is the William RUTO for you. Yes. We must save this country. Kenyans, wake up. We must save our country.
So Mudavadi na Ruto wakiwa huko US walikuwa wamesign deal fulani ya 200 billion Kenyan shillings ya inaelekea SHA na medical staff na nini hizo vitu za medicine. So kumekuwa na some people in the critics ama the opposition side wanasema ya kwamba tumesign deal ya pesa mzuri sana, na sisi ndio the first country imesign hiyo deal, kwa sababu hakuna country nyingine imesha sign hiyo deal na US. Sisi ndio wa kwanza tumesign hiyo deal. So wanatuambia kwamba tumesign tu deal, lakini government haijatuambia hiyo deal ina entail nini pale nyuma, yani kuna vitu zimefichwa pale hivyo. Inamaanisha tutauza data zetu about health, SG genes, nini. Kuna vitu mingi sana tutauza, records mingi zenye zitakuwa zinaendea US zenye zifai kukua kwa mkono zao. Sisi tutakuwa tunapea hizo information kwa mkono zao, kwa sababu sisi tumesha sign hiyo deal. Tunataka 200 billion Kenyan shillings tujisaidia nao in health nini, to strengthen nao SHA, tufanye nao nini. Lakini in real sense tumesign vitu ambazo zinaweza tu affect. Tunaweza sign data za health ambazo tutapea US, ambazo wanaweza tumia against us, wanaweza tumia in any way, wanaweza tumia in a very bad way, wanaweza tumia kufanya research zao. Like kuna tu vitu fulani data fulani zenye hatufai kuwa tunashare na countries zingine. So even ndio the critics ama the opposition wana argue about the factor. So mi sijui una feel aje, kwa sababu deal nayo ishasainiwa ya 200 billion na sisi ndio tutakuwa the first country ku benefit from it. So mi sijui, hata mimi sijui juu vile critics wanasema kuna ukweli ndani ya hiyo kitu critics wanasema. So wewe labda unasema aje kuihusu pia wewe?
Salam guys, in geopolitics, aid is never withdrawn just to be withdrawn. It's withdrawn to reset the rules. Now, part 3 of the US-American healthcare framework deal. This is what is happening. Just the other day we had US aid. What did Trump do? Call it off. You remember what happened to NGOs? The scare that was there? Yes. So now this is US aid backdoor inakuja with conditions. It's conditional. Funding now that is conditional. What happened to saying we're withdrawing aid because now we want to make America great again? Yeah? Let countries take care of their own SHIT. Now, the only benefit that I'm seeing in this whole thing is that the funding now is no longer coming through middlemen. Middlemen is the NGOs. Now the funding goes directly to the government. I think that's the only thing that our government could negotiate. Anyway, if anyone has seen the contract and the contents of the contract, because that is all what we are waiting to see, the contents of the contract that was signed by, is it Wetangula or Mudavadi, who is the Prime Cabinet Secretary? That one. And by the way, did you know that the Constitution has no provision for the Prime Cabinet Secretary position? Yes, the man who signed that deal, US-Kenya deal with Mark Rubio. Can we challenge that document? Because it is being signed by someone, someone sitting on a position that is not within the provision of the Constitution. But then again, what do I know? Salam guys, watch out now for part 4. Salam guys, do you know what deals mean? Mnaelewa maana ya deals? Now let me tell you, your president aliena akatu sign in a deal. Yeah, Kenya-US health deal. This is the part 1. So what caught my attention is when the president said, we express our deepest appreciation to the government of the United States under the leadership of Donald J. Trump for choosing Kenya as the first nation to sign such a framework. Sasa tunapewa ni 208 billion. 208 billion is money that we can easily raise because at some point 1.3 trillion could not be traced in 7 months. So 208 billion ni pesa tunapewa in how long? Yet in 7 months, we cannot trace, we do magic, 1.3 trillion in a disappear. Yet this is a deal that will be done for years and years to come. Anyway, stay tuned for part 2. Ile makasiriko mtakasirika by the time I'm done with this series. God help me.
Ladies and gentlemen, Kenyans of goodwill, President RUTO is at it again. He's currently on tour to the US. He's going to witness a peace treaty being signed. But aside from that, he's also going to sign away our health sovereignty. Now, we are not citizens of the United States. But because RUTO is going to sign away our health sovereignty, the United States now can access medical records for Kenyans, data that belongs to us without our consent. Remember, health is devolved. Again, we are not United States citizens, so I wonder what the United States government would want to be doing with our medical records. I keep saying the agenda is one. I keep saying protect your data, protect yourself. They are trying to gather data, gather information, and they're doing it by all means possible.
So after ile Ruto kukalishwa kwa bench pale USA kama mtu anangoja kuingia hospitali na pia kuuza our health data, medical data at 207 billion. Sasa ameanza kuthank the US government. Just because US government haikukuuliza uliua Albert ama kina Rex Masai and the rest of the Gen Zs ulikuwa una abduct kwa nini? Now you think US imekuosha. And you think you are so clean. Now Albert is alive again. Kina Boniface Kariuki wanauza mask pale Ronald Gara Street. Unadhani tumesahau? Tumesahau all the corrupt scandals zenye umetuibia pesa. Hiyo pesa ulipewa in USA, the 207 billion. Hiyo ni pesa tungeweza kukabin corruption hapa Kenya. Si tunapewa 207 billion, nyinyi mnapora over 500 billion in 1 year. So kuna haja gani tupewe? Mnapewa ndio mkuje mpore. Then you made promises, hii pesa kutakuwa na accountability. Accountability tunajua ni Sudi na Faruk. Wakitumia wanaandika maprices zingine hapo tofauti. You should not think we are stupid, my friend. Kwenda US na kurudi, it doesn't make any difference in Kenya. Umepewa 207 billion. Hiyo ni pesa kidogo sana in an economy like Kenya. Kwa hiyo by corruption every day tuna lose over 5 billion every day. So hiyo ni pesa ya mwezi moja na nusu. Na unakuwa hapa, I think the US, you are there simping. Praise and worshiping the US government. Wewe, hebu nikuelezea William Ruto. Nothing will ever cleanse you. Wewe ni one term. In fact, hata sio one term. Ni kukusamea, tulikusamea. Wewe ni one term na tunakushida free and fair. Hatuwezi endelea kusaviwa na government like you, full of promises and excuses. What? One term.
President Ruto will allow the American government to access all Kenyan health records if he signs the Model Specimen Sharing Agreement. According to whistleblower Nelson Amenya, your health records, your children's health records, every test, diagnosis and treatment will be accessible to the American government. They will access the medical data without your consent, without any restrictions on what they can or cannot see, and there will be no anonymization of identities, so your identity will be revealed. And this is unconstitutional because your right to privacy under Article 31 will be violated. The Kenyan Health Act of 2017 will be completely violated, and according to that law, health information is confidential unless you sign a written consent, the court orders disclosure, or there is a serious threat to national health. And the Digital Health Act will be completely violated. The Digital Act protects patients' data, including their privacy, confidentiality, and security. And shockingly, your health data will be managed by American law and not Kenyan law. If they follow American law, then it means your Kenya data protection rights will not exist to them. It means the Kenyan courts will be completely powerless because it is not within their jurisdiction, and it will also mean that the Office of the Data Protection Commissioner will be powerless as well. And shockingly, the US government will get the data from Kenya for 25 years, and in return, Kenya will only get a limited funding from US from 2026 to 2030. And the US government can share this data with 10 pharmaceutical companies, and they will develop vaccines and drugs for the diseases. And if Kenya fails to comply, the US government will discontinue the funding, and it may also terminate the agreement. So basically, the medical data of over 50 million Kenyans will be handed over to a foreign government and a foreign law without the consent of Kenyans. According to Amenya, the government must disclose this agreement to the public. There should be a parliamentary debate, and the MPs must either approve or reject the agreement, and there should be full renegotiation of the terms of the agreement to make it fair for all parties. Nelson Amenya is the activist who revealed the secret Adani deal. And Koala said the only reason they would need so much data is because they plan on turning Kenyans into lab rats for experimental drugs.